So Mimi Blanc and Jessica Yu, so you're both with the Aphasia
program.
program.
University.
So yeah, we're just real excited to have you here. We're learning more about aphasia and how that affects our members and how we can be more helpful. So.
Okay, so the title of our presentation is Learning About Aphasia and Communication Tips. We're going to be going over a little bit about what aphasia is, some of the different characteristics of individuals with aphasia, and some great communication tips that you can use working with individuals with aphasia. But before we begin, we kind of wanted to get a little bit of information about you all, like your roles here, what are some things that you do here at the Silver Club, things like that. So,
Are you nurses? Are you assistants? Volunteers?
So you want to do a round?
So,
Sure, yeah.
Okay.
we're not we're a social
Okay.
day program, day enrichment program model. And we have folks, everybody from mild cognitive impairment to a more moderate expression of memory loss. We've got groups that meet just once a week, and then we have 5 days a week, a day
Okay.
program that are here. And we do have people, and we have had folks in the past that have had language barriers or language difficulty.
Thank you.
Okay.
All right, so let's go on. Before we got into it, we found this short clip from, I guess like not a documentary, but like an informational video created by the National Aphasia Association called It's Still Me. And it's, maybe for the YouTube video that popped up. But we just kind of wanted to show a little clip from the video. Excuse me.
Is there a URL link?
There
Is that what-
is, so that's why I'd asked if there was a connection to the internet, because it connects to YouTube.
Yeah, there, wait a minute here, we didn't do that little banner thing at the bottom. But where's the URL in it, though?
It's embedded.
It's embedded in it?
Yeah.
Oh, I thought that was, I thought that was your video.
Well, either way, let's find it as but I can get to the website if that's easier. Okay, let me see if I'll write from this one here.
Here, hold on 1 minute. Maybe if I just invoke the internet first and get there needs to be the screen that you say accept.
Oh, got it, okay.
That's
for
what
the
I'm
web.
looking for. Here, all right, now, okay, so you have internet access here, because you can see there, you're on the health system, so let's see what your, looks like it's doing something. Maybe not. But it's embedded in
Right.
so we're not gonna
Yeah.
see the blue hyperlink?
Yeah. Alternatively, it's always, works perfectly when you test it.
I know.
I know,
Then
and
when you get
on the
somewhere,
someplace,
this is the
right,
story
and
of our
all the-
life.
So, well, your hyperlink isn't, like, it's not highlighted, is it, to, like, just invoke it?
We
Oh,
just
works
tested it
so
for-
well when you
okay, well,
don't. Then-
It's a really great video, so let me see if I can find it on
Yeah,
YouTube
I bet you,
itself.
let's do that.
Um,
That's a great idea. And we'll make life easier.
Huh? I don't know, I'm used to seeing them, it's more like the hyperlink, and you just click on it, and then it comes in. internet here is not the fastest.
Okay.
No, ours at work isn't always the
No,
greatest
right.
either.
All right. It's just, yeah. We'll watch this for maybe 2 minutes.
I was living my
Just to
life.
get a little background.
It happened so fast, land. Don't know who I am. I was living my life in Kablam. Don't you recognize? Don't you see? It's me in here. It's me in here. Don't you recognize? Don't you see? It's still me. The words that are still in my head, they just don't sound like what I said. I know that green's not red, but the words get stuck inside my head. I tried to talk, it's not clear. There's a stranger with me in here. I try to be strong, but the words come out wrong, never clear. And now everything takes time. Have to look round my head just to find what used to be easy and breezy. Now it takes time. The words, they're still in my mind, but they're just so hard to find. Please, won't you be kind? 'Cause the words, they're stuck inside my mind. I'm a stranger in a strange land. Folks don't know who I am. They talk too fast and they don't know who I am. The words are still in my head. They just don't sound like what I said. I know that green's not red, but the words, they're stuck inside my head. I know I'm not quite the same, so instead of talking brain to brain, let's talk heart to heart. That'll be our new game. Let's talk heart to heart. That'll be our new game. Let's talk heart to heart. So that was just a short clip of the video that was put out by the National Aphasia Association to kind of educate the public regarding aphasia. And they did it very well. They wrote, I think they hired a musician to create a song specifically to describe the experience of what it's like to have aphasia. And I'm not sure if you caught it, but there were instances in which the character was saying red, but they meant green or stop and go, and that's a very common phenomenon for individuals with aphasia. What they mean to say doesn't always come out as the actual word, and the opposite may come out. So they were giving some really good examples of what are some really common characteristics. And
Right.
we'll go into a
And I
little
think
detail.
the one where they had the brain was all, it looked like alphabets and words. We have clients who will tell you, it's in there. It's just all mixed up, and they can't get what they want out. And so it was really very well illustrated how we've heard people with aphasia in their own way communicate that to us.
Okay.
So I'm going to talk a little bit about aphasia. It's an acquired language deficit. It impairs ability to speak or expression. And people with aphasia vary in the degree of severity of their verbal skills. Some may say nothing, or some may say single words. Other clients may use like telegram, if you remember telegraphic speech, where they have nouns, 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 and you have to understand what they're saying, and maybe a verb. and others will say sentences but may leave small words out. So again, depending on the severity of the stroke and where the damage is, impacts the degree of expressive problems. Comprehension or ability to understand, oftentimes varying degrees of severity. Some will understand most conversations. Some may not even be able to follow a simple command or understand a yes/no question. And people with aphasia are socially very appropriate, so pragmatically they'll wave and say hi to you, and they'll go uh-huh. And I can remember we saw a client that was an elderly woman sitting in the waiting room, went up to her, how are you? Fine, and how'd you, and the therapist went in and evaluated her, and I said, how'd she do? She says that's the only thing she could do. She was so impaired, she understood so little. And families, sometimes when we see them, they'll be surprised. They say, oh, he understands everything. And then when we sit with them and they see how they do, they go, oh, I didn't know that he didn't understand. So reception is oftentimes there with deficits. So you have to pay attention, because they will be so socially right and they act like they understand, and a lot of times they're missing a lot of the information you give them. Reading and writing, again, some can read novels, some cannot even match words. Some can read single words or can read only parts of sentences, nouns and verbs. There's varying degrees. Occasionally, thinking and memory deficits, although that's more classical of a head injury, we do see that. Depending where the damage is of the stroke, if it's more in the frontal area, you might see some more cognitive kinds of things with thinking and memory. Estimated over 1 million Americans have acquired aphasia.
Which is a very shocking statistic.
Yeah, it really is.
Are we able to ask questions as you go
Sure.
along? Okay. So it's my understanding that aphasia is the effect from or the aftermath of a stroke.
Correct.
Oh, okay.
Yes.
Among other etiologies or other
Yeah, but
incidents.
the main aphasia, the stroke is the main cause for aphasia. Yeah, I mean, there are others, and,
We had a gentleman recently who came in with a traumatic brain injury. He had fallen from, I think, a telephone pole, because he works for AT&T and is one of the maintenance men, and he required aphasia from that incident, so.
brain tumors too. We've had some clients with brain tumors from cancer, sometimes too meningitis, various things. But the main cause of aphasia, I would say, is stroke. And I think this is pretty much what we say right here. And it occurs in the middle cerebral artery, and there are 200,000 new diagnosed cases every year, and likely will increase as the population ages. I think this is where you take over.
Okay, so we just mentioned other injuries, again, reiterating, could include head injuries, brain tumors, migraines, other neurological disorders such as Alzheimer's, dementia.
But we have a current person in the program who has frontotemporal dementia. and has-
Okay.
Okay.
Some word
has
finding
some
it
issue.
difficulties, yeah, and that's definitely another cause for aphasia.
Many people have never heard of aphasia, and but it is really more common than cerebral palsy, muscular dystrophy, or spinal cord injury combined. And I think that's what makes it even more devastating to a family member. I had a family member say to me, yeah, they told me in the hospital he had amnesia. To come here, he'd be well in a month. I said, I said, well, I think it's going to take longer than a month, and it was aphasia. So people hear of strokes, and they know people that have strokes, but they don't often know that people can also have aphasia. And I think this lack of understanding and knowledge is really as devastating as the disorder, because even I've had clients whose family members have been nurses, and they go, yeah, we read about aphasia. It was like 3 sentences in a paragraph. Or recently had a client whose wife is a nurse and teaches nursing. She says, gee, I never Catherine knew speech and language was so complicated after you had a stroke. So I think, our role as clinicians is educating and making people aware of it. So, doing what we're doing here is really an important role to make you aware of what aphasia is and understanding it and learning how to communicate with people with aphasia.
So, Mimi, let me make sure I'm clearly understanding. So when someone suffers a stroke, it's predicated upon the area of the brain that is affected. Okay.
Right.
So if someone has aphasia, it's usually affecting the communication piece of the brain.
The language
The
area.
language area, yes, okay.
And
Yeah.
yeah, we'll get to that in a
Right.
bit. We have like a
Yeah.
image of the brain showing kind of
Right.
the areas responsible for language and
Right.
speech.
Aphasia is a language-based disorder, so anything language-based will be impacted, such as math is another one, arithmetic skills. It's really language that's impacted, so we'll talk a little bit more about that.
And the last point was just regarding this, the communication barrier and the inability to properly express yourself as well as understanding language results in decreased access to resources in our healthcare system, just because patients aren't able to advocate for themselves, they're not able to communicate and express their wants and needs and desires. And that becomes an extremely frustrating thing, having to have other family members or friends to communicate on behalf of you and not really being able to express what you really want to say.
And if you don't have anyone to advocate, it's even worse, and that's really
So onset is sudden, just as with any strokes, neurological diseases, traumatic brain injuries, it can happen at any time without warning. Also, aphasia doesn't discriminate. It can happen to any person at any age, any gender, any race. And there's also a growing, I would say, population of young stroke survivors.
Right.
So individuals maybe in their 20s who are getting strokes and as a result of that, having aphasia.
And actually, where we work, a lot of our clients are young. You think of a stroke in a person's 70s or 80s, 90s. These people are in the 20s, 30s, 40s, and 50s. So it happens in younger people for various diagnoses. They may have an undiagnosed hole in their heart. That's a common one, and all of a sudden they have a stroke. So it does happen. Depression is as high as 70% among people with aphasia. And I'm sure you can understand why. They've lost all control of their life. Many have to retire. Everybody's making decisions for them. They're physically disabled. Oftentimes, and just go touch base on this a little bit more, family and friends walk away from them. So they're really isolated. So a number of our clients actually are on medications for depression. We had a recent client, I don't think you know who it was, but who was on meds. He took himself off of it. I said, you shouldn't take it off when you're in this intensive program, but he did. And what happened was he could not function as well in therapy. He became agitated, he was tired, his ability to function was just not as effective. So fortunately, he went back on it and there was an improvement in his whole attitude. A lot of times people, once they get a year, it seems like around a year, people with aphasia oftentimes become very depressed. This is when depression will come on. Not all people, but some. The reason, they're starting to realize that they're never going to be like they were before. That this is a whole new life. They're a different person now. And to face that reality is very devastating. It would be for all of us. So it seems like once they get beyond that, to like 16 or 18 months, they've adjusted. I wouldn't say they accepted, but they've adjusted. And then they move forward. So other things that can occur with aphasia is apraxia, and this is a motor speech disorder. This is the inability to volitionally say things, and we'll have an example. To move your arm, to make gestures, to say sounds and words. And then dysarthria, again, this is one where they're unintelligible at times, and you may have heard that. They make imprecise articulation, they omit words, the voice may be very soft, they may talk in a monotone. They may not have an adequate breath support. So these are all parts of, can occur also with aphasia.
So as we touched upon, the impact of aphasia is pretty severe and pretty broad. It affects not only family, friends, and community, but it also affects their individual perception of self and identity. So personality changes can happen. Amy had mentioned that had mentioned to me that some clients come in and prior to the stroke, they were maybe more assertive, more aggressive, and after the stroke, they've become a little more docile, a little more soft, a little more calm and quiet. So that's a really interesting personality change that spouses have noticed in individuals who've had a stroke and who have aphasia. As we had mentioned, family and friends, because of this difficulty in communicating, it creates a barrier. So they begin to isolate themselves, withdraw from meaningful connections and relationships that they used to have with family members and friends. It can also disrupt family dynamics, so role reversals, as well as relationships with spouses and children, in addition to causing marital strains at times. And then community, decreased participation in community activities and events, so maybe once a robust social life, now after having aphasia, they become kind of social hermits, and that can be an extremely depressing, extremely devastating situation to find yourself.
Right, and I think the impact on their communication is what they need. Our friends, they need to communicate, and it has just a reverse impact on them, because now when they're isolated, they're not communicating, you know. So many clients sit in front of a TV.
Right.
That's their main mode of entertainment.
Right.
So what aphasia is not? A loss of intelligence. They're just as intelligent as before. This has nothing to do with their IQ. Always remember, it's a language disorder. A loss of hearing. Invariably, we notice that family members start screaming at their loved one with aphasia. For some reason, they feel that talking louder helps them. Not necessary. They don't have a hearing loss. Occasionally, someone with a stroke might have a mild hearing loss, but most of them hear probably better than some of the therapists. A loss of memory? Not necessarily. Again, that would be very specific if the damage was done in a certain area. A static condition. The fortunate thing is people with aphasia, the ones we work with, recover. They get better. Over time, they improve. I'm not going to say that they get back to the way they were before, but they improve. The one thing about people with aphasia is that their performance is inconsistent. So one day they may be talking and understanding and feeling so good about themselves. 2 days later, they're not talking, or they're not understanding things so well. They're confused. We had a client last week who came to me on Monday. He says, I want to apologize. I was really bad on Thursday. I said, no, you weren't bad. He says, I was having a really bad day. I said, well, you did very well. But again, this idea, so, you know, it's not really static. They improve, but they are inconsistent. Mental instability, not at all. They're very mentally stable. Sometimes people view them as unstable because they're not able to communicate, or they might act a little differently. Their gait may be different. And I had a client who was driving. He was stopped by a Michigan State trooper, and they made him stand up and walk, and he couldn't walk well. He couldn't communicate well because he had aphasia and he had physical disabilities. They took away his license, so he had to go to court and get it reinstated. So again, we as clinicians need to educate, but again, they're not mentally unstable. They're totally intact. So here's some famous people that had aphasia. and I'm sure you recognize most of them. Dick Clark, of course Gabby, Patricia Neal, Kurt Douglas, Julie Harris, who actually came to our program for one session, and Gordie Howe. And there are many more. I mean, you'd be surprised the number of people in the theater and, you know, famous people all over that have had strokes and have aphasia at some degree or some kind of speech problem.
Okay, so this is just a quick clip or a picture of the left hemisphere of our brain. So for most individuals, the language centers are housed in the left hemispheres of the brain. Some of the major areas include Broca's area here in the navy blue, which is responsible for language expression, so talking. The yellow area is Wernicke's area, which is responsible for language reception or understanding language, whether that be through the auditory route or through our visual route, so reading. Some of the other ancillary areas include the auditory cortex, which processes auditory information, so spoken language, and then the visual cortex, which processes visual information, which would be used for reading. So aphasia doesn't just affect listening or understanding and speaking, but it also affects reading and writing. And so any time there's a stroke that may affect any or all of these areas, aphasia will be involved.
Okay, so I'm going to talk very briefly about the types of aphasia. I'm not going to go into all of them because some are more common than others. And I keep saying this, but they're varying degrees of severity. So on the other hand, I want to say, even though some may be mild and some may be more severe, most of our clients and most people with aphasia do need some augmentative or compensatory strategies to communicate with. And we will talk about that. There are always going to be some communication breakdowns for them. So the ones I'm going to talk about, fluent, would be the anomic, and these is sort of the benchmark of people who have aphasia. It's severe word finding problem, coming up with nouns, coming up with verbs, getting their ideas across. You'll hear lots of or they might, what we call circumlocute around the word. Oh, you know, it's that big thing, it's round. Oh, you know, it starts with a B, and it's that, oh, it's a ball. Yes, it's a ball. But they can't say ball, but they'll give you a lot of different words. Or they may say a synonym for it. So they all have, at some level, some word finding trouble, and that's anomic. The other one is a Wernicke's, and they're very severe. They have very severe aphasia because they oftentimes say a lot of meaningless words, or what they say does not have any meaning. Sometimes it's intelligible, sometimes it's not, but it doesn't make sense. And in addition, they don't understand. So you're dealing not only with verbal skill problems, but also listening skills. And they're unable to repeat words. So if you say, oh, did you mean train? You won't get train. You'll get some unintelligible word. Another difficulty with Wernicke's is that when you talk, you hear yourself. So you can monitor what you're saying. A Wernicke's cannot do that. So even if you say to them, well, did you hear what you said? No, and you say it back to them, they don't understand. They go, this is it? Or when they say something to you, they expect you to understand it because they're not hearing what you're saying. So they get very angry and frustrated, and they blame you or the poor spouse, therapist, like, you're not understanding me. And a lot of it has to do with the fact that they're not hearing themselves as well. So you'll hear one in our video. And then the non-fluent, here we have a Broca's, and they're actually a common type of aphasia. They have difficulty self-initiating speech. That's fluent. So they may use a lot of single words. It may be said clearly. Their understanding is good, but they can't repeat. And then the global is the most severe. So they really have difficulty understanding and expressing themselves. And they can do very little. I saw a global a number of years ago, did absolutely nothing in the evaluation. I showed him a cap at the end. He picked up his tiger cap, put it on his head, and got up and walked out the door. That was, I thought, okay, you know what you're doing, you've got it in there. But that was all he did for me, so. So let's,
Let's hope this video
Yeah.
works.
this is a recent stroke, actually.
Okay, so here's the picture,
That's me.
and do you need your glasses? No. Yeah, do you want to put them on? Yeah.
So he's looking at a picture and describing.
So can you tell me anything about that? Can you talk about that picture?
Well, there's a picture on the chair. Is that the school?
Yeah. Can you show me that with your
You see how he's not really hearing himself? He's just saying
Right.
fair, fair, whatever, fair.
Oh,
And he's not trying to self-correct. He's not aware that he's saying words that don't make
so
sense.
that's the boy or the
Boy,
man?
boys, boys.
And actually, what he was doing was pointing to things. But what he was saying was not
Was
what
he
he,
pointing to the things that, he was pointing to the right things, but he wasn't identifying them
couldn't
as.
say 'em.
Right. Is it just to keep that, huh?
It's a picture of the, wild picture.
So like on the picture, there's, I think, a family having a picnic and there's like
A
a little
sailboat.
boy, right.
And there's a little boy walking a dog, and there's a girl building a sandcastle, and there's a house and some trees and a car.
So a lot going on.
Yeah, lots of things to talk about. This man, he's been to our program a number of times now. He's a non-fluent, has non-fluent aphasia, and he's 4 years out. He's actually doing much better, I have to say.
Right, and he has really good self-monitor, like he knows when he
Yeah.
says something
And
that's
his
off.
comprehension is very good. He's reading, he's starting to write. He's actually, when he left this last session, he was here this summer, he was producing some sentences, and he's starting to really participate in life. So he's doing very well, really.
Okay, so we'll just play a short clip from this
Yeah.
one as well. So it's uploading. Fix that. Good time,
Well, maybe we'll hear him.
I don't know, this one's not working.
Is it not working?
Oh,
Oh,
so,
Quick time,
okay.
Well, I think what you would have seen in this video is he had a really difficult time initiating. So again, that difficulty initiating speech, and a lot of like this, that, like talking around the word, you know,
But
that.
he's, again, he's doing better with initiation. The self-initiation is coming out with single words. He's very slow in getting the words out. And his speech is very clear.
Mhm. And I think in the next slide, we have a group.
Yes.
Yeah. And so we also do communication groups at our aphasia program to kind of help elicit communication in a group setting, in a safe environment for them to practice communication skills. So we just did a short video clip.
Hopefully it will work.
Let's see, hopefully.
remember that first one worked fine.
I know, I
So
don't
why is
understand why.
it's Right,
It's
you're just
the
in the same.
internet
I was gonna say, it could be the internet connection gets lost, sometimes
It's
it's
not very good.
on
Yeah.
and sometimes it's not, right. I don't want
But
one on
it's
the
like,
laptop.
it's just the
something like
nature
that.
of giving presentations, like even like, you go in, it's like
Oh.
the top facility, it's like, it always happy.
I know, and
Without a
that's the
doubt,
thing,
there's
no
always
matter how many
technical
times you go through it, worked perfectly at the clinic, and then
Yeah.
some of it worked here and some of it didn't. I'm sorry.
Well, okay, well, we'll just move on, but again, it was, we would ask them topics to discuss, and they would try to communicate with one another, talking about things like favorite movies, favorite TV shows, foods, travel, all sorts of different interests.
Right. Groups are really good because it really empowers them if they're able to communicate. It's also peers force them to use their communication skills, and they develop some self-confidence and friendships. So groups are very effective with people with aphasia. So these are just some situations that I'm not sure if you have these situations, but these are kinds of things that you might run across, that there'll be breakdowns with people with aphasia communicating. For example, participating in a conversation in a group or a noisy environment. Very difficult. Inability to initiate, having a noisy environment, they're distracted by other sounds, they're under pressure to talk, and they get very frustrated. It takes them longer to get the words out. They have to think about what they say. Things that you and I say automatically, they can't do that anymore. They have to think about it. Think about what they're saying, if it's right, are they making their lips the right way to produce the sound. Saying names, and I'm guilty of this, I'll tell a client, oh, tell everybody your name, and they're like, that's one of the hardest things to do. Communicating their own personal thoughts and needs with their families, with their spouse. They just have a very difficult time giving you novel information and expressing their feelings. Telling jokes, talking on the phone they do not like, which, again, that's a pressure cooker for them. They can't see the person, they're being asked questions, and trying to get that information across clearly and quickly. Comprehension, I think we've talked about that a lot. Directions and questions, listening to several conversations at once, or doing several things at once. They can't do it. It's overload for them, and we'll talk about strategies. Or following discussions on television or the radio. I did a group many years ago where we all watched a little snippet of the news, and I got it, but nobody else did. And it was the speaking rate of the announcers, the news reporters. They talked so fast, and I wasn't really aware of it, that they could not absorb the information. Same thing with a radio, or even listening to information on the internet. It's just, they can't process it. They need that extra time to take everything in and understand it, and then to respond to it appropriately.
So with that, reading is also a very laborious task. Just having all these words splattered on the page and being able to only pick out a few words at a time, it just becomes very overwhelming. So they need extra time to read as well. Oftentimes having like a visual marker, maybe just blocking out one sentence at a time, kind of using a finger tracking technique so that they can read out each word will be helpful. Written expression, so writing, even basic things like their names, family member names, their address, phone numbers becomes very, very difficult. And often they're learning to write with their non-dominant hand. So most individuals are right-handed. When you have a stroke on the left side, it affects your muscles on the right side. So that right side might be weak or maybe paralyzed, so they're learning to also work on legibility and writing with the left hand. And arithmetic skills. So numbers, I think without a doubt for all our clients is so difficult. But I always say the top thing that's difficult are numbers. So reading clocks, counting money, and numbers is such a big part of.
They get so frustrated,
community
and
life.
it's so hard for them. It really is a hard
So
task.
those are some of the challenging communication situations.
So, are there any experiences you can share with us that you've had with maybe some people with aphasia, or?
I think the experiences that I've experienced you've addressed well. We do have a client here who has aphasia, and when I ask her, do you want coffee? Yeah. You know, give it to her. You want cream or sugar? Yeah. You know, or you want to wash your hands? Yeah. Everything is, yeah.
Very agreeable.
Yeah, very agreeable. Yeah, it was challenging for me trying to figure out what does she really mean yes to, or what did you?
Yeah, so you need to give them choices. Do you want cream or sugar? And if you need to, write it down. Or even show them cream or sugar. And I think, or do you want coffee or tea? And giving them a choice will help you get a better response, probably a more appropriate response. I think she truly probably is not understanding yes or no all the time, so that's why they're gonna say yes to everything. Or they might say no to everything, you know, depending.
Anything else?
Anything else?
Well, one thing I guess I want some clarification on is, so our folks have memory loss. So when they struggle for word finding, or they kind of ramble on, not kind of making a whole lot of sense about kind of what they're saying, we've all had interactions with folks like that.
Okay.
Is that, I thought that's due to their memory loss.
Yeah.
But is that classified as aphasia?
It's probably, with that, it would be an anomia, the word finding problem, that is, and, yeah, we could try.
And I think depending on whether there was an underlying, like, neurological, like,
Yeah.
if they had a history of a stroke, or if they had a history of a brain injury or a brain tumor that may have affected that left side of the brain where those language centers are housed, then definitely there could be like a comorbidity
Yeah.
with aphasia.
Right.
But if there isn't like a lesion, or there hasn't been an insult to that left side of the brain where the language centers are housed, then it may be a result of dementia
It
or
could be.
the memory itself.
You know, I think that aphasia doesn't happen in a vacuum often.
No.
So that if we have our folks with dementia, they may have aphasia, but it also is affecting other parts of the brain as
Right.
well.
Right. And
So aphasia isn't just
no.
the
And I think,
language.
right.
Often you see these things, aphasia is one piece of it.
Right, and I think what happens too, you have people who probably their main diagnosis is dementia, but
Right, it's
they
like
probably
Alzheimer's,
also
but we
have,
see what
yeah,
you're
some issue,
describing,
yeah, is
you know,
aphasia.
these word finding
Right.
things, these kind of garbled
Right.
stuff, people,
right, and I guess
we
really,
see them.
it could be too, it really doesn't matter how it was caused, but if they have aphasia, you need tools to, you know, strategies. So it could be from a head injury, or it just could be a result of the dementia
Right,
of the brain.
regardless if it's
Yeah.
dementia, we're seeing, we
Yeah, you
deal
see
with
it,
the folks who have these
Right.
exhibit these types of
Right.
behaviors or
Right.
deficits.
Right.
So how is it some of the strategies that
Right,
you use for
so what-
aphasia are applicable here?
A
for
lot
sure.
of them,
Yeah.
right, so.
Okay, so that's like a really good segue right into some tips for talking. The biggest thing that we like to tell, sure.
We have a handout, actually.
There's tips, like there's a family.
And we have extra lots, so you're welcome to keep the extra ones, I don't know.
Thank you.
So I think the top thing and the biggest thing I tell individuals, like family members, spouses, or individuals who interact with persons with aphasia, is to be patient. So again, slowing things down a lot. And that goes also with when we're communicating, slowing down our speech. Speaking a little bit slower, focusing on key words, repeating and reiterating, making sure that the message was communicated. Another really important tip is to treat the individual with aphasia as an adult. I think oftentimes people will have the misconception that, you know, they're not understanding intelligence is an issue, and they tend to patronize a little bit, which can be extremely frustrating. But that's another big tip. Also to keep in mind that the main goal is the successful communication of a message exchange, so not to demand or expect perfection, but understand that mistakes will be made, wrong words will be substituted or said, but to focus on, has the message been communicated? If so, move on. And another one is to give all of your attention to the individual, if possible, to the individual with aphasia. They kind of take into account nonverbal cues in addition to words that are being spoken, just because that understanding portion is impaired. So they'll read facial expressions, they'll read body language, they'll read intonation, prosody, all these different aspects to communication that is just as important, if not more, for successful communication. And then I would say using tools, as Nate mentioned, writing things down and giving options of two, showing pictures or images of something to make sure that they did understand what you were asking them and that they are able to communicate what they want. And then lastly, to be flexible. You can, in addition to writing things down, you could also draw things. That's something we also use with some of our clients. And many of them have become very proficient at drawing diagrams or drawing images, even though they maybe weren't so artistic beforehand. So whatever means necessary that will help facilitate a successful communication.
And having a sense of humor, that helps a lot. You know, when people get totally frustrated, it's good just to say, okay, let's take a break and laugh it off and we'll move on. It's important to do that as well. So these are some of the tools that we use, we use a lot of different things, but we have what we call picture dictionaries. And actually, I was thinking these might work something if you do have clients with word finding problems. These are, I can pass one out. Yeah. They have different categories of words in them. So like in different categories. So like if you turn to home, there are different words in them. And what we do is we really label them. So we put labels on the side of certain categories. So if someone is trying to express something about something they had for lunch, they go to the food and you could say, okay, so where is it? And they could point. Or if they're trying to tell you, you know, about their family, again, pointing to something might help them come up with the words. And so we use this a lot. And then the written word is below, so that they can maybe read the word in addition to pointing to the word, picture. So they're really pretty helpful.
Also, the Oxford Picture Dictionary has put out
Or even, you know, top theme cards. I was just thinking you could do themes or something like that. Something would be like that. But it's true, I think with any group you need some structure, and they do work better, they participate well. And with someone with aphasia, you definitely would get better verbal output, and comprehension would be better as well. So this is what we do. I'm not going to talk about our program, but we do some full-time and part-time speech and language therapy. We can evaluate people. We are going to be starting a weekly language group called ACE, which is Aphasia Communication Enrichment. I actually looked that up because I couldn't remember the title we came up with. And this will be a group that meets 3 hours a week. We're still deciding on the venue. It will be a large group and then we'll have for an hour talking about current events. Then it will be a smaller group that we'll divide up the clients where they might do some technology, reading or writing. And then the last group will be like with the clients and family members working on communication or communication challenges. And then again, we do in-services like we're doing right now. And then there are volunteer opportunities for people with aphasia. We do offer some opportunities at our clinic for people with aphasia to interact with our other clients and to have some, build up their self-confidence and self-worth. Any questions?
Any questions?
Could you talk a little bit about creating an environment that's conducive to communicating?
Okay.
Do's and don'ts?
I think, well, a really important one is a quiet environment, so reducing background noise, just because that's across the board. We find it so difficult when there's a lot of noise going on. They can't focus, they can't concentrate, so reducing the background noise.
So don't yell across the room.
Right.
Right.
And maybe don't have
Yeah,
like
joke.
doors slamming and shutting, people coming in, chit-chatting. Just having a quiet environment, I think, is one.
That's
important
very
thing.
key. And not a lot of visual distractions in a way. You know, if you really want to have them focus on the task, I mean, most of our rooms are pretty bare, you know, and, you know, not a lot of busyness, because they're easily distracted. So I think making it, and I think I get to the fact, and I'm going to say it again, is really planning a structured task and structured activities where they can stay focused, things that are of interest to them. With aphasia therapy, they always say, you know, capitalize on their interest, you know, really capitalize on what they're interested in. You know, if they want to talk about the football game, I didn't want to last week, but, you know, but anyway, if they want to talk about it, then that's what you need to do. And so I think so much of making it a good communication environment is for you, us as clinicians, is to give that structure to them and give them opportunities or choices of what you want to do. Like, do you want to, I mean, I do this all the time. I said, do you want to work on listening? Do you want to work on reading? Or you want to work on talking? And I go, talking. I said, okay, we'll work on talking. So we do that. I said, okay, then what do you want to work on? And they go, oh, we still want to work on that. I said, no, we're going to work on something else. But, you know, I think they need that. They need that guidance. And to me, that's what creates a really good therapy environment.
Yeah, and I think also, I feel like speech therapists, we tend to talk a lot with our hands, but because they're relying on a lot of visual information, not just spoken information, so maybe being a little more animated with your
Right.
hands, using things, do you want to, you know, go here, or we naturally just use
Do it.
all the time. We
Writing,
gesticulate
writing,
a lot.
and writing. Writing things out, putting it on the board so they can see it. So many people with aphasia need that written information to understand. Giving them a lot of context. I mean, I think that's what we do with people with aphasia. The more context, the better they're going to respond. Novel information, novel is not, you know, something new, I wouldn't introduce them. Something they know, that they have knowledge about already, that's the direction you want to go with them in any group session.
So speech therapy works generally with people with aphasia, not PT. Is that
Right,
correct?
physical.
Well, yeah.
Oh, okay.
We work on the language.
PT's working on physical impairments, and
Right.
usually like lower limb and occupational therapy.
Oh,
Does the upper limb.
Yeah.
And we
Thank you.
do the mouth.
So in addition to aphasia and
Yeah.
speech and language, so
Yeah.
like swallowing, cognition as well.
Right. And children, we work with children too. I mean, we do a lot of disorders, so. Anything else?
What about the idea, is a speech the same way, like if you don't use it, you lose it?
There's some things about that.
Right, I'm thinking of a conversation I had with a family member who encouraged us to, like, just say the alphabet with the
Yeah,
a particular
automatics are
person.
great.
So whenever we did our music, we started out by singing the alphabet song because
Right,
this
on.
particular person would eventually kick in and sing the alphabet song.
Mhm.
And, but now can't
Yeah.
do that. Now, unlike the stroke people who you say
Right.
get better,
They don't.
those with memory loss, they
It's
aren't
different.
ever gonna
It's
get
a
better.
different,
Yeah.
Yeah, I mean, the automatics are great, you know, counting, saying the
Yeah,
days of the
so
week.
we would incorporate,
And
let's
singing is
count to
great.
20, let's do the
Yeah.
alphabet song. And so those kinds of rote things, we could get some response from this individual.
Definitely, those are all great things. Those are things
Yeah.
that we do as well.
Yeah.
Those are, okay.
Yep.
Those are wonderful.
But to answer your question, use it or lose it, I think, yeah, for sure, there's been tons of research that's been put out. The brain is like a muscle, like any other muscle in our body. If we don't use it and exercise it,
Right, so
a
the
lot of
same
the
is true
skills.
with the speech. If someone doesn't talk,
Yeah.
they will lose that
Right.
ability to actually speak.
Right, and so when we even send our clients home, we tell them the best thing you can do is to continue talking and continue to work on your speech, because you will regress. You know, if you sit in front of the TV or you just sit doing nothing, you'll regress.
Right.
They need that ongoing stimulation,
Right.
forever and ever.
Yep.
It's never gonna change.
Thank you so much.
Yeah, thank you.
Well, thank you for joining us today.
Yeah.
Of course, and then we'll definitely send a copy of the PowerPoint to you, Doug, that way you can share it with anybody else.